All right, good afternoon, everybody, especially Ashley, because she's here. Thank you, Ashley. Like I was just telling Ashley, today we will be going over the innervations of the muscles. And what I've done is I've grouped them together. You will get the innervation sheet probably somewhere in the second week that you guys are here. You'll see it. I've got it. It's on a Word Perfect. I'll send that to you guys. Well, I'll give it to you guys when you guys get here on campus. So what I'm going through today is I'll give you a nerve and I will show you all the muscles that are innervated by that nerve. Another way that you can study it. I feel like going through your flashcards, you get an innervation for each muscle, and it's kind of hard sometimes to correlate it sometimes with other muscles. So I'm hoping that doing it in this fashion will help you guys out. Tomorrow will be kind of the same thing, but I'm going to be doing it with movements of the body, such as, all the muscles that perform ankle dorsiflexion. I've got all of those muscles all separated out for you guys. So it's just another way for you guys to hopefully study the muscles, the actions and the innervations, which are very, very important in everything that we do as physical therapist assistants. So with that in mind, these two sessions over the next 2 days will probably be a little bit shorter. Next week is the 4th week of our semester. So what I'm going to do is I'm going to kind of go back and go over the bones again and go over the muscles again. And that'll lead us to the Wednesday where I'll kind of review some stuff, and hopefully there'll be some people here that have some questions. Wednesday will be the last Zoom meeting. But like I said, Monday, we'll go back to the bones and start from scratch again. These are the bones. These are the landmarks of the bones, and I will go over the bones that will be on the competency also. The same thing with the muscles. I'll go over all the muscles, muscles that'll be on the competencies, and we'll go over actions and origins and insertions and stuff like that. All right, so that's the next couple of days. I am now going to share the screen with you guys. Ashley, do me a favor, just tell me when you see this. It should say innervations on the top.
I think it's loading.
I'm sorry?
It's loading right now.
Okay.
I can see it
now. Okay, fantastic. Thank you so much. So basically this sheet runs about 3 pages. There are a lot of nerves in the body, and there are a lot of muscles that are innervated by these nerves. So again, what I've tried to do is try to connect them for you and correlate them so you get an idea of where these what muscles these nerves innervate. So let me go here. All righty. Okay, so we'll start with, I've got these nerves in alphabetical order as I could. Actually, I did this last night while I was watching the football game. It was enjoyable watching the Cowboys lose. Always enjoyable. Yeah, I did this and the movements last night. So we'll start with the accessory nerve. the accessory nerve is actually cranial nerve number 11, my mistake. The cranial nerves will kind of go over a little bit at the end of the intro course. We talk about some neurobiology, and the cranial nerves are part of that. The cranial nerves basically are nerves in the head and face that help us with swallowing and chewing and seeing and smelling. So there are 12 of those nerves, and the accessory nerve is cranial nerve number 11. And two of the muscles that you guys will really need to know, and that they're in, the muscles that are innervated by the accessory nerve, cranial nerve number 11, is the trapezius muscle. And I'm talking about the entire trapezius. Remember, we split up the trapezius into an upper, a middle, and a lower. But the entire trapezius, all three sections of that muscle, is innervated by the accessory nerve. The other muscle that is innervated by the accessory nerve that you need to know is the sternocleidomastoid, the SCM. Remember, we spoke about that muscle over the last couple of days. It has its origin on the sternum and on the clavicle, and it inserts onto the mastoid process. So like I said, literally the name sternocleidomastoid is telling you what's its origins and its insertions are. The axillary nerve is different from the accessory nerve. So those two sound alike, but they are very, very different. The axillary nerve innervates the teres minor. Remember, the teres minor is one of the rotator cuff muscles, one of the sits muscles, supraspinatus, infraspinatus, teres minor, and subscapularis. So teres minor is innervated by the axillary nerve. And the deltoid muscle, which is that other muscle that we split up into three parts. Remember, we split the deltoid into an anterior, a middle, and a posterior portion. Well, all three of those portions are innervated by the deltoid, by the axillary nerve, sorry. So the entire deltoid is innervated by the axillary nerve. The next nerve is the dorsal scapular nerve. And again, these nerves also, they come from, again, the cranial nerves come from basically the brain themselves. But most of the upper extremity muscles comes from something known as the brachial plexus. And so we'll talk about that also during the last week of intro. The dorsal scapular nerve is one of those nerves that come from the brachial plexus, not one of the major nerves. But you'll notice, remember, levator scapula was that muscle that comes from the transverse processes of C2, C3, and C4, and it inserts onto the superior angle of the scapula. Now, the rhomboids, which are below levator scapula, but they are in this pretty much the same area. The rhomboids are on the transverse processes of let's see, I kind of brain dead on that one. I think it's like C7 through like C7 through like T5 or T6. Remember, it comes from the middle portion and it inserts onto the medial border of the scapula. So both of these muscles come and insert onto the scapula. The levator scapula is at the superior angle, and the rhomboids are a little bit further down on the medial border. So both of those muscles insert into the scapula, and both of those muscles are innervated by the dorsal scapular nerve. All right, dorsal scapular nerve. The next nerve is a lower extremity nerve. Remember the femur. So the femoral nerve is one of our really big, important nerves that we need to know. The femoral nerve innervates many of the very important muscles of the lower extremity. The iliopsoas muscle, which is the main hip flexor of the body. Remember, it's a combination between the iliacus and the psoas major. The rectus femoris, which is one of the quadriceps muscles. And it is the quadricep muscle that does extension at the knee, but it also does flexion at the hip. Remember, that's that two joint muscle. And rectus femoris has an origin at the AIIS. Compared with the sartorius, which is that long strap-like muscle that has its origin at the ASIS, and its insertion is on the pes serine. Remember, there are three muscles that attach onto the pes serine: the sartorius, the gracilis, and the semitendinosus. The other muscle group that is innervated by the femoral nerve is the vastus group, which is the other part of the quadriceps muscle. The vastus group, made up of vastus medialis, vastus lateralis, and vastus intermedius. It's those three muscles and the rectus femoris that make up the quadriceps group. So when you're thinking about the femoral nerve, you're thinking about all the muscles of the quads. You're thinking about the sartorius, which is a very superficial muscle, where the quadriceps group is deeper, and the iliopsoas, which is a muscle that is the strongest hip flexor. The fibular nerve is a lower extremity nerve, and it has many of the muscles of the lower extremity, and most of these muscles do plantar flexion of the leg. You'll find these out tomorrow. The muscles that are innervated by the fibular nerve are tibialis anterior. Now you will see some of these muscles I have kind of shortened. So EHL stands for extensor hallucis longus. So that's the muscle that extends the big toe. Extensor digitorum longus, that's the muscle that extends the toes 2 through 5. And the three fibularis muscles. So remember I said, if you ever see the words peroneus and fibularis, they mean the same things. But remember I said, if you know it as fibularis, you know those muscles are coming from the fibula, which means those muscles are coming from the lateral side of the body. Now, these three muscles do plantar flexion, and they do eversion also of the ankle. So the fibular nerve. The inferior gluteal nerve is the nerve that innervates the gluteus maximus. Gluteus medius and minimus are innervated by different muscles. So the inferior gluteal muscle is the innervation of the gluteus maximus. The intercostal nerves, again, intercostal means between the ribs, and it kind of makes sense that these muscles are innervated by this type of nerve. The rectus abdominis, which is above the ribs and does have an attachment point on the ribs. The internal and external oblique. Remember, the internal oblique rotates the body to the ipsilateral side, and the external oblique rotates the body to the contralateral side. So if I turn my body, if I rotate my trunk to the left, well, the left internal oblique is working and the right external oblique is working to perform that motion. So the oblique muscles are innervated by the intercostals. And finally, TRA, I told you guys that the TRA stands for the transverse abdominis muscle. This is the main core muscle of the body. All right. So this muscle also inserts onto the linea alba of the rectus abdominis. So the TRA is innervated by the intercostal nerve. The lateral pectoral nerve, well, the pectoralis major is innervated by the lateral pectoral nerve. Okay, so again, when we're looking at specific muscles like gluteus maximus is the inferior gluteal nerve. You'll have to understand that, there really is only one muscle. One muscle that is innervated by that nerve. Well, the same thing with the pectoralis major. All right. The pectoralis major is the lateral pectoral nerve. And if you look down a little bit further, the medial pectoral nerve innervates the pectoralis minor. So you've got pectoralis major, which is superficial, and you got pectoralis minor, which is deep to it, but they're innervated by two different parts of the pectoral nerve. All right, so pectoralis major and minor are innervated by the pectoral nerve, but major is lateral, minor is medial. The long thoracic nerve innervates the serratus anterior. Remember, I spoke about the acronym. This is an important muscle that the national exam really does like. Serratus anterior, long thoracic. So when I think of SALT, I think of the serratus anterior being innervated by the long thoracic nerve, SALT. The teres major, which is, teres major is located on the lateral border of the scapula. Remember, teres major is not one of the rotator cuff muscles. Teres major is not. Remember, supraspinatus, infraspinatus, teres minor, and subscapularis are the rotator cuff muscles. Teres major, which is below the teres minor, is innervated by the lower subscapular nerve. And I just spoke about the medial pectoral nerve that innervates pectoralis minor. Now, the median nerve is a very important nerve of the wrist area. It is the median nerve, and I spoke about this, that carpal tunnel syndrome has a problem with. Remember, when we spoke about carpal tunnel, there's a small tunnel in the wrist area here that the flexors of the wrist and the median nerve go through. There's a piece of tissue, a retinaculum that covers it. And when there is pressure put on that retinaculum, and there's pressure put, especially on the median nerve, it can cause pain and numbness and tingling into the hand and into the shoulder. Well, that's what carpal tunnel syndrome is. Well, the median nerve is the nerve of carpal tunnel syndrome. And you'll notice that there are all flexors, a lot of the flexor muscles that are innervated by this nerve. Now, the first two, pronator teres and pronator quadratus, well, those are the pronators of the forearm, the muscles that bring the palm downwards. But pronated teres has an origin on the humerus and an insertion onto the radius. So it actually crosses the elbow, which means it actually has a flexion component at the elbow. It's not a major mover of elbow flexion. Remember, we have three major movers of elbow flexion: the biceps brachii, the brachialis, and the brachioradialis. But God forbid those muscles lose their innervation or become very, very weak. Well, pronated teres can actually be used as an elbow flexor too. Some of the other muscles that are innervated, I do have them, they are shortened. So the FCR is flexor carpi radialis. Remember, this is the muscle that attaches on the radial side of the hand. Palmaris longus attaches to the palm. Remember, it's that muscle that like 10% of us don't even have that muscle. I have it on my left hand, but I don't have it on my right. It's interesting stuff. FDS is the flexor digitorum superficialis. And I spoke about the flexor digitorum superficialis as the muscle that only goes to the PIP. So it does this motion at the PIP, but it does not flex the DIP, the distal interphalangeal joint. That's the flexor digitorum profundus. Remember, we've spoken about that. Those two muscles are very, very important. So remember, median nerve innervates flexor digitorum superficialis and profundus. Superficialis does not do the DIP. Profundus does the DIP. Very important. Finally, the other muscle that is innervated by the median nerve is the flexor pollicis longus, the muscle that flexes the thumb. Pollicis means thumb, hallucis means big toe. The musculocutaneous nerve, this is a nerve of big time importance. The biceps brachii is innervated by musculocutaneous. The coracobrachialis, again, that muscle is telling you where its origin is at the coracoid process, and it inserts onto the brachium, hence brachialis, or the humerus. So because of the origin and insertion, the coracobrachialis only has one job. It flexes the shoulder. It does nothing at the elbow. Finally, the other musculocutaneous nerve is the brachialis muscle. So those three muscles are of major importance to the shoulder and to the elbow. Biceps brachii flexes the shoulder, flexes the elbow, and supinates the forearm. Coracobrachialis flexes the shoulder, and brachialis is the main elbow flexor. Remember, it's the workhorse. The obturator nerve is a nerve found basically in the hip area, and we have a few muscles that are innervated by that one. Two of the adductor muscles, adductor longus and brevis, are innervated by the obturator nerve. Gracilis, that muscle that comes from the pubic area and inserts into the pes anserine, that area on the anterior medial proximal tibia, where there's two other muscles, sartorius and semitendinosus, also insert into the pes anserine. And finally, the pectineus, one of the lateral rotators, one of the muscles that you're not going to need to know. Remember, the only lateral rotator that you will need to know is the piriformis muscle. The radial nerve is a very innervated nerve. Many of the muscles of the forearm are innervated by that, especially the extensors and supinators. The extensors and supinators are innervated by the radial nerve. So the triceps brachii is an extensor of the shoulder and the elbow. I'll skip brachioradialis for a second. Anconeus is that small muscle that does elbow extension. Brachioradialis, though, does elbow flexion. Remember, it does elbow flexion with brachialis and the biceps brachii. The supinator muscle, that's innervated by the radial nerve. Now you will see the list of extensor muscles, which is quite vast here, that the radial nerve innervates. Extensor carpi radialis brevis. Extensor carpi radialis longus. So those two muscles are on the radius side, on the thumb side. Extensor carpi ulnaris. That one's on the pinky side. Remember, anything with carpi does not go to the digits. But the rest of these extensors do. Extensor digitorum extends digits 2 through 5. Extensor indices, that is EI, extends the index finger. Extensor digiti minimi extends the pinky finger. Extensor pollicis longus and extensor pollicis brevis both extend the thumb. So after we flex it, we bring it back. This is extension back to the neutral position. Well, extensor pollicis longus and brevis perform those actions. And finally, APL is abductor pollicis longus. Abductor pollicis longus is the muscle that abducts the thumb, bringing the thumb towards you. And adduction of the thumb is bringing it back to neutral. One of the most important nerves in the body and one of the longest nerves in the body is the sciatic nerve. Now, you will learn that there are different parts of the sciatic nerve. You'll learn about that a little bit later on. But right now, all I need you to know is that the sciatic nerve innervates a lot of the big muscles of the lower extremity. Sciatic nerve innervates all of the hamstrings. All the hamstrings. Semitendinosus. Remember, I said semitendinosus is on the medial side of the leg. Semitendinosus is the most superficial medial muscle. And semitendinosus is the third muscle that innervates into the pes anserine. Remember, again, the pes anserine located on the tibia, on the anterior medial proximal area, literally right next to the radial tuberosity. And those three muscles, semitendinosus, sartorius, and gracilis, insert into that area. The semimembranosus is another one of the hamstring muscles. This muscle also is on the medial side, but in comparison to tendinosus, it's deeper. It's harder to palpate. Biceps femoris is the hamstring muscle located on the lateral side of the body. And finally, adductor magnus, the large adductor muscle that has its insertion onto the linea aspera of the femur, the back of the femur, and also the adductor tubercle, a large protrusion on the femur. Well, remember we spoke about adductor longus and adductor brevis earlier. our obturator nerve, where adductor magnus is the sciatic nerve. So those four important muscles are innervated by the sciatic nerve. Remember, we spoke about the gluteal, the gluteus maximus being the inferior gluteal nerve. The inferior gluteal nerve. Well, the other gluteus muscles, gluteus medius and minimus, are the superior gluteal nerve. It's interesting considering that gluteus maximus is superficial and so large, it's the inferior gluteal nerve, where gluteus medius and minimus are deep to max, but it's the superior gluteal nerve. These names have been around for centuries. I didn't make them up. I know I've been around for centuries, but these names have been around much longer than I have. Another one of the nerves that is innervated by the superior gluteal nerve, and it really does make sense, is the TFL, the tensor fascia lata. Remember, the tensor fascia lata literally comes from the gluteus area. It comes from the gluteus area, so it makes sense that the superior gluteal nerve innervates the tensor fascia lata. All right. Believe it or not, we're getting close to the end. A lot of muscles, a lot of nerves. It's going to take you guys a lot to study these. So I would start with the flashcards and get the origin, get the insertion, get the action, and get the innervation. And then come back and see if you can make a correlation with the, with this sheet, with the nerves that we put them together. So the suprascapular nerve, so this is a nerve that is above the scapula, all right? And it's the nerve that actually goes through the suprascapular notch. Well, it's the two muscles that are above and below the spine of the scapula. The supraspinatus and the infraspinatus are innervated by the suprascapular nerve. All right. So if you think above the scapula, well, the muscle that's above the scapula, that is above the spine of the scapula, is the supraspinatus. You just have to correlate that infraspinatus also is innervated by that nerve. On the back, we have the thoracodorsal nerve, the thorax on the dorsal side. Latissimus dorsi is that very big muscle, and it requires, this is not a nerve that can share its innervation with a lot of muscles, because latissimus dorsi is such a large muscle. Remember, latissimus dorsi is coming from the sacrum, and it's coming from the lower four ribs, it's coming from the lumbar vertebra, and it comes from the inferior angle of the scapula. Then it kind of spins around and attaches into the bicipital groove of the humerus. So it's coming from all the way from the bottom, from your bum almost, all the way up to your arm. Large muscle, requires a great deal of innervation. So the thoracodorsal nerve, that's its only job, is to innervate the latissimus dorsi muscle. The tibial nerve, again, the name is telling you where it's located. It innervates muscles right off of the tibia. So remember, I spoke about the popliteus muscle. Popliteus was that muscle that that unlocked a flexed knee. Well, popliteus is innervated by the tibial nerve. The two large muscles in the calf, the gastrocnemius and the soleus. Those two muscles are tibial nerve muscles. Plantaris is a muscle that you're not going to need to know, but I want you to understand it. Remember, it's that muscle, the muscle that's very, very small, but its tendon is very, very long. All right, that's the plantaris muscle. The tibialis posterior, the muscle that's on the back of the tibia, and it does plantar flexion, just like gastrocnemius and soleus. Gastrocnemius, though, does knee flexion because its origin is on the femoral condyles of the femur. Also, that innervated by the tibial nerve is the flexor hallucis longus and the flexor digitorum longus. All right, two of the muscles of the lower extremity. In the hand, we have the ulnar nerve. Ulnar nerve, so will be on the ulnar side. Radial nerve will be on the radial side. So the ulnar nerve innervates muscles that are on the pinky side. Kind of makes sense. Flexor carpi ulnaris. Flexor digitorum profundus. The lateral half, the medial half. All right, flexor digitorum profundus is split between the ulnar and the median nerve. I think it's ulnar and median. I don't think it's radial. Give me a second. Let me just make sure. No, it's the median nerve. So flexor digitorum profundus, that muscle that has an action at the DIP, has a dual innervation between the median nerve and the ulnar nerve. Now, remember I said that the suprascapular nerve innervates the supraspinatus and infraspinatus. Well, the muscle on the anterior side, the subscapularis, is also innervated by the upper and lower subscapular nerve. The upper and lower subscapular nerve, below the scapula. So if you think below the scapula, you're thinking subscapularis. Same name, same beginning. So upper and lower subscapular nerve is the subscapularis muscle. And finally, the last nerve is the ventral rami, which comes from the lower back area, and the quadratus lumborum muscle, the hip hiker of the body, is the muscle that is innervated by the ventral rami. So that is all of the nerves and muscles that are innervated by those nerves. Again, this is just another way for you guys to hopefully study these nerves. This is one of the hard parts of this. The innervations are difficult. My recommendation to you guys is to get the main muscle innervations. And what I mean by that is when we're talking about the shoulder, we're talking about all the rotator cuff muscles, talking about deltoid, pec major, talking about the biceps, talking about the elbow flexors, about brachialis and brachioradialis, and we're talking about triceps, the big muscles. When we're talking about the forearm, you want to know definitely about flexor digitorum superficialis and profundus. And you want to get the large leg muscle groups. So iliopsoas, the big hip flexor. You want to get the quadriceps. So no rectus femoris and all of the vastus muscles. The hamstrings. So rectus femoris, semimembranosus and semitendinosus. And the calf muscles, gastrocnemius and soleus. you can get those muscles down pat, those big muscles, you're talking about half of the muscles that you need to know. Those are the main muscles. Those are the ones we work on the most. And then you can go to the secondary muscles, like the other forearm muscles, the pronators, the supinators, and then some of the other leg muscles, the smaller leg muscles, tibialis posterior, tibialis anterior. All righty. Short video, it's a short one today. You get to relax, Ashley.
Yesterday I got tested.
I'm sorry?
I got tested positive for COVID today. So
oh my.
A little sick.
Oh, I'm sorry.
I don't feel as bad as I thought I would. I just
please take care of yourself.
Yeah.
That's always my thing. Stay healthy. Yeah. Oh my.
It happens, I guess. I go to the stores.
I'm sorry?
I go to grocery stores, it's gonna happen, like maybe once or whatever.
That's scary.
Yeah.
Did you feel bad?
Yesterday, I started feeling a little more than a normal cold bad.
Okay.
So I just decided to get tested just in case.
Oh, I'm so sorry. Please take care of yourself. So you're quarantining?
Yeah. So I have nothing else to do but study, so it's fine.
All right. Well, don't study all day. All right. I'm going to stop this video. I will send it out. The paper that I went from, you guys will get in the second week. So hopefully it will help you out in your studies. That's the idea of that. All right. So tomorrow we'll go over movements. Okay. All right. You stay healthy, please.
I will.
You got a couple of weeks. That's good. You don't have to worry about anything. So that's just get healthy, please. Don't.
I will. Yeah, I'll be fine in a few days.
Hopefully. All right. You just take it easy.
Yeah.
All right. I'll see you tomorrow.
All right, bye.
All right. You have a good afternoon. Feel better.